All right. Hello, everybody. We're really excited to dive into the meat and potatoes of this webinar, but first want to start with some introductions. My name is Eleanor Carrick. I'm the Regional Administrator in the Mountain States region. I'm based out of the Core Center at Oregon Health and Science University in Portland, Oregon. Today, I am presenting alongside Virginie Siriana, who is the Regional Administrator for CDC Region 4 North, based out of UNC Hemophilia and Thrombosis Center in Chapel Hill, North Carolina. And I want to shout out Susan Lattimore, who's monitoring the chat to make sure we don't miss any of your questions today. Susan is the Regional Director for the Mountain States region, based out of the Core Center at OHSU in Portland, Oregon. Most importantly, I want to welcome you on behalf of the entire Patient Satisfaction Steering Committee for the fourth National Patient Satisfaction Survey, or PSS, as you may see or hear it called today. So welcome. Thank you so much for joining us for this webinar. Next slide. Our agenda for today is to start with a brief background of the survey. I'll touch on why and the why and the how of administering the survey and how the results are delivered to you. And then I'll pass it over to Virginie, who will spend some time reviewing the national results for the fourth National Patient Satisfaction Survey. Then we'll wrap it up with next steps. As I mentioned, Susan is monitoring the chat and we encourage you to use it. So if you want to spend an extra minute on a chart that we're showing today, or you have a burning question, please put it in the chat and we can pause to discuss or review that chart. All right, so let's get into it. As the name of the survey suggests, the aim is to promote patient and family voice and highlight areas of success and challenge from the patient perspective, from the perspective of individuals receiving care at United States HTCs. We want to know, what are HTCs doing well and where can HTCs improve the quality? I think we can all agree that feedback from the patient perspective is so valuable. And there are probably a million ways to receive that feedback. However, this national survey provides such a unique opportunity to standardize collection across all HTCs. Through that, we're able to see trends over time in the care provided, and importantly, and maybe increasingly important, the opportunity to provide information that help us all advocate on and off the Hill by documenting the value of HTCs to patients from patients directly. Next slide. In addition to those reasons of why we administer, there is research showing the link between patient satisfaction and health outcomes. So in 2001, Vermeer et al. Showed the link between shared decision-making and positive interactions between patients and providers and how that influences patient satisfaction. And then both Glickman et al. In 2010 and Justin et al. In 2008 found that patients who are satisfied with their care are more likely to follow their treatment plan, and that leads to improved health outcomes. So these are really foundational building blocks to the patient satisfaction survey. Next slide. So how do we do this? How can we understand patient satisfaction as a whole to improve health outcomes and HTCs, and understand patients' experience of care and where we can improve quality? Cue the National Patient Satisfaction Survey. So organizing a national survey takes a whole lot of people. We have a Patient Satisfaction Steering Committee, which is made of regional administrators with backgrounds in nursing, public health, research, pharmacy, social work, all within HTCs, a health communications specialist, a data analyst, and a research manager. In addition to the steering committee, regional administrators have played a huge role in getting this survey up. So thank you. We've also had a lot of support from our national partners and leaders at NHPCC, HRSA, the CDC, ATHN, NBDF, HFA, FWGBD, the Coalition for Hemophilia B, and the Hemophilia Alliance. They've all helped to get the word out to either patients or HTCs through newsletters and social media. we couldn't have done this without HTC staff, everybody that distributed the surveys directly to patients. We want to call out that the survey itself is voluntary, so there's no dedicated funding, but there's a lot of value, and that's why we do it. The survey, as I said previously, was the 4th national survey. We have conducted the survey in 2015, 2018, 2021, and now 2024. Really important that these surveys are on the care received in the previous year. We don't collect any PHI and has run through the OHSU IRB this year and was deemed not research. Next slide. So if you have not already seen a copy of the survey, I encourage you after this webinar to go on to htcsurvey.com and view the example survey. So you can see all the questions that patients received. But in essence, it was a 2-page survey front and back. It was self-administered, meaning patients filled it out themselves. For individuals under 18, patients and caregivers were asked to complete the surveys on behalf of the youth. But it was disseminated as a paper survey and also available online. It's available in English and Spanish. And again, participation was voluntary and all of the responses were anonymous. The survey was collected from February through the end of June for online, and then the paper surveys, of course, continued to trickle in, so we kept receiving those. And again, that's on care received in 2023. The regional leaders oversaw survey implementation. They got all the information out to centers, and then centers or HTCs disseminated to their patients. We did encourage that each HTC patient within a household completed their own survey, and then all aggregated results were returned to centers. So not individual results, but we'll get into that. All right, so the survey collected basic demographics information and asked for feedback regarding satisfaction with staff, services, and care. There were questions around barriers to care related to insurance, language, COVID, and new in this iteration, distance. Importantly, probably my personal favorite was the open field for comments. Next slide. So by now, all HTCs should have received their results, which came with the following information. If you have not received your results, I encourage you to talk to your HTC's PI or primary contact for the PSS. Every center should have received HTC-specific results in an Excel document, an Excel with HTC-specific comments, a PDF with HTC results that came with HTC level, regional level, and national level. We'll show you an example in a minute. And lastly, a data dictionary that just has some information. Next slide. So this is an example of the Excel that everyone received with HTC-specific data. You can see it's all the responses, and it should be still anonymous. You can see there's age ranges there to keep some of that privacy. Next slide.
Say that again? Yes. Nice.
Here is an example of the comments that you would have received for your center specifically. My personal favorite. Next slide. And then here's the PDF. And this one, like I said, has your HTC level results next to regional results and national results. So as we get into it today, we're going to look at that national column. And here's the data dictionary. So if you have questions about what the options were, what somebody could have put in there, you can review this. And next slide.
Right, so I was trying to unmute myself and change the slides at the same time. So sorry for the delay. I will take over and thank you, Eleanor, for your presentation, start of the slides. And we'll go now over the results. So who participated in our fourth survey? 129 US HTC out of 141 participated, and we had over 5,370 patients that responded to the survey. 34% of these the surveys were actually filled out by the patient's caregiver. So we had a slight increase this year, but great numbers, over 5,370 patients. That's a lot of data. So looking at the demographic of the patient who responded to the fourth survey, 79% identified as white, 5.4% as Black or African American, 4.8% as multiracial, and 3.5% as Asian. And then there's smaller numbers as well, but you can all see that we have a diversity of patients answering this survey. In the last survey, the question about patient race also included the option to fill out a blank. So 1.9% wrote down Hispanic as race. So we included this in this chart. For ethnicity, 1.9% responded Hispanic or Latino, and 85.5% responded not Hispanic or Latino. And all these data, when you receive, as Eleanor mentioned, your data, you can compare your HTC to the region and then to national data. And what I'm presenting currently is the national data. So 57% of patients opted to complete the paper survey instead of the online version. We understand that it is very time consuming to be mailing all these surveys out. And it's also very time consuming for OHSU to enter all these data that comes from the paper survey. But as we can see, it's really a good method of distribution for our patient. It's a big number, 57% of patients still fill out the paper survey versus online. Looking at language, 3% of the patients chose to complete the survey in Spanish. We'll dig into these numbers later on in the year when we start looking at more of the data, but 3% is a small number. So moving to the gender chart, there's many female participated in the fourth survey. There's an increase from 29% participation from the first survey in 2014 to 36.8% in this fourth survey. Same for diagnosis. Patient with hemophilia represented half of the respondent, while von Willebrand represented about 31%. Compared to the 2014, our first survey, we also see a decrease from 62% to 50.4% for hemophilia patient, while von Willebrand increases from 25.9% to 31.2%. Other factor and bleeding and other bleeding disorder combined had a big increase from 9.1% to 16.8% from the first survey in 2014 to now. So as our female patients are increasing, we also see an increase in von Willebrand and other bleeding disorder patients in this survey.
That's going to be the one.
So looking at the overall satisfaction, satisfaction remained high for 2023 with 95% of patient reporting being always or usually satisfied with HTC care. So kudos to all because this is really nice data to see. Patient satisfaction, which HTC staff also remained high in 2023, ranging from 96 to 98.3% satisfaction. We can really see all the hard work all the HTC staff is doing nationwide. Um, your outstanding work is providing great care for patients. So process and services satisfaction remained also high in 2023, with a range of 94 to 99.6% of patient reporting being always or usually satisfied. The processes and service mentioned in the survey included ease of getting care when they needed, ease of reaching the HTC for urgent needs, staff explaining things in an easy to understand way, staff spending enough time with the patient, treating patient with respect, involving patient in making decision regarding their care, and coordinating care with primary doctor or other specialties. In the fourth survey, the question regarding satisfaction about the HTC Pharmacy Factor Program revised and divided in two separate questions. The updated question were, did you receive medication from the HTC Pharmacy Factor program? And it was a yes or no question. And if they answer yes, did the HTC Pharmacy Factor meet your needs? So this change was made in this survey, in the fourth survey, to improve clarity. So looking at the pediatric to adult care transition, this fourth survey was a little different in the age range. The survey used to look at patient age 12
Now we'll continue boarding through the blue lane with boarding group 1.
Let me mute. So I'm sorry about this. The survey used to be for patient age 12 to 17 and was changed in the fourth survey for patient 12 to 24 to better align with our URSA grant objective for this grant period. Looking at barriers to care, please note that this graph here is a little different as it reports always, usually, or sometime a barrier to obtaining care. For insurance, barrier has slightly increased through the last three survey, while language remained low in the past two surveys. COVID is less of a barrier, but patients still report an issue in 2023. And in the fourth survey, we added the question of distance as a barrier. We have 18.6% of respondents indicated that distance was always, usually, or sometime a barrier to care. So lastly, the open-ended comments. As mentioned earlier by Eleanor, you should have received a document including all your HTC-specific open-ended comments in an Excel document. Take a time to read through all these comments. There's a lot of great comments, and share them with your team. Most comments are very positive, but if there's some that are not so positive, take the time to look and see if there's areas of improvement. When good comments, print them out, put them on the board, give yourself a pat in the back. These are real comments from real patients that really appreciate all the work you do. So looking at next steps. What's next? Well, this data can be used to improve care. You can help identify strengths and areas of improvement, both at HTC level, region level as well, national level. PSS Steering Committee will continue to analyze all this data. The result will be shared through one-pager, posters, article, and things like that. We'll try to keep you updated as needed. And also we start planning the PSS5, which will begin in 2027, and that's for care received in 2026. So hopefully we'll have good results again. It's a lot of work, but very rewarding, very good data. And we welcome any inputs. So if you have anything you want to add or say, please, I can put this in the chat maybe, or just take a screenshot for the email. And then I think we're, oh yeah, and please visit the website. This is where we post our one-pager posters and information on the results. And lastly, we want to take a moment to really thank all our patients, parents, and caregiver that completed the survey, and Hemophilia Treatment Center who spent a lot of time helping us distribute these surveys and put a lot of work into it as well. Regional administrators and directors that have helped us disseminate this survey. The MSS and Thrombosis Center at OHSU, the data management. So that was a lot of work. Thank you very much. And also Eleanor and Susan at the center. Our partners from NHPCC, HRSA, CDC, Athens, NBDF, HFA, FWGBD, Coalition for Hemophilia B, and Hemophilia Alliance. Hemophilia of Georgia for the Spanish translation. All the PSS committee, and then all the support, HTC ERSAT Regional Network, and HTC 340B programs. And now we can open the floor for questions or comments. And let me stop sharing so we can see your beautiful faces.